Just a couple of weeks ago, a Columbus homeless shelter faced a positive case of COVID-19. That person was immediately taken to their quarantine shelter and is still recovering. 10 TV's Stephanie Stanovich is talking with the shelter on handling situations like that and their plans for vaccine education and reassurance.
As a homeless shelter, the thought of having to turn someone away due to not having enough space is frightening.
What we did in response to that was really walk through our buildings and try to think very creatively about how we could use space differently.
Sue Valillo is the Assistant Vice President of Community-Based Services for Lutheran Social Services. At the start of the pandemic, their faith mission, a homeless shelter for men, women, and veterans, transformed.
We have a lobby in our main building, a waiting area, and a lobby for our health center. Those have both been turned into dorms, and we actually have men living in those areas. We had a training room that we now have women living in.
Inside are plexiglass barriers and an air purification system added to their HVAC.
That it will help with both purifying the air and surfaces within the building, and that will happen continuously.
Faith Mission staff is also tackling the issue of how to handle vaccine distribution within the shelter.
I think as far as the vaccines go, really educating people about the value of the vaccines, about what they can expect as far as any kind of side effect goes.
And the staff is working to reassure each person living there that it's okay to be honest if they don't feel well.
We wouldn't just kick someone out because they were ill. We get them to the proper resource.
Faith Mission has a federally qualified health center on site and a partnership with the Community Shelter Board,
who is operating a shelter for isolation and quarantine.
As the days go on and as shelters care for those currently with them,
I anticipate, as do others, that we will see an increase in homelessness a little bit further down the road.
In Columbus, Stephanie Stanovich, 10 TV News.
Twice a day, they're taking temperatures of all residents and staff, along with asking medical questions. There's about 100 staff members, but they rely heavily on volunteers.